glimmers of sight, unraveling the enigma of ancient Egyptian cataract treatment.
For millennia, the dimming of sight caused by cataracts has been a universal plight. While the Indian surgeon Sushruta is widely credited with the earliest detailed descriptions of couching, a method to dislodge the clouded lens, around 600 BCE, tantalizing hints from ancient Egypt suggest an even earlier awareness of cataracts, and possibly even rudimentary attempts at their treatment, dating back to the dawn of recorded history. These suggestions, though often interpreted from ambiguous artistic and archaeological records, offer a fascinating glimpse into the early stages of ophthalmology in one of the world's most enduring civilizations. The 5th Dynasty Enigma, the scribe Carper and his eyes. One of the most compelling pieces of visual evidence comes from the Old Kingdom, specifically the 5th Dynasty, circa 2467–2457 BCE. The famous statue of the scribe Carper, also known colloquially as Sheikh el-Balad, village chief, due to its striking realism, is a life-sized wooden effigy discovered in his mastaba tomb at Saqqara. What captivates medical historians and ophthalmologists about this statue is its remarkably lifelike eyes, crafted from polished rock crystal, copper, and alabaster. While the right eye appears clear, the left eye distinctly features a subtle, milky white opacity. This detail has led many to interpret it as a deliberate, artistic representation of a cataract or a severe leucoma, corneal opacity. If this interpretation holds true, the Carper statue serves as the earliest known artistic depiction of an eye pathology akin to a cataract. It profoundly illustrates that this specific form of vision impairment was recognized and observed by ancient Egyptians. While the statue itself doesn't show a surgical procedure, its existence raises the thoughtful, tantalizing question: if the condition was so clearly depicted, were there also attempts to address it?
New Kingdom narratives, reliefs, and instruments. Moving forward to the New Kingdom, circa 1550 to 1070 BCE, particularly the 19th dynasty, circa 1279 to 1213 BCE, we find more direct, albeit still interpretive, evidence from tomb paintings and the discovery of medical instruments. Ancient Egyptian medical papyri, such as the Ebers papyrus, extensively detail eye diseases and their remedies, often involving herbal concoctions, poultices, and incantations for conditions ranging from conjunctivitis to infections. However, these texts typically lack explicit step-by-step instructions for complex surgical procedures on the eye's internal structures. It is in the tomb reliefs that some scholars believe we see subtle indications of more invasive interventions. Certain scenes, like those found in the tomb of User-Hat, TT 56, in Thebes, 18th dynasty, depict physicians attending to patients, sometimes with instruments seemingly near the eye. While specific details are often obscured by artistic convention or damage, these scenes, combined with the discovery of slender, pointed bronze and copper instruments that could potentially be used for delicate eye work, lend weight to the argument that some form of ophthalmic surgery might have been practiced. The prevailing hypothesis among those who believe in early Egyptian cataract surgery leans towards a rudimentary form of couching. This procedure, later well documented by Sushruta, involves dislodging the clouded lens from the visual axis. Given that couching requires minimal incision and specific fine instruments, it's conceivable that Egyptian physicians, with their advanced understanding of anatomy from mummification and their sophisticated tool-making capabilities, could have attempted such a procedure. Why suggestions and not definitive proof? Despite these intriguing pieces of evidence, the assertion of widespread or documented cataract surgery in ancient Egypt remains in the realm of suggestions rather than definitive historical fact. Several factors contribute to this. Ambiguity of iconography. Artistic depictions, by their nature, can be open to multiple interpretations. An instrument near an eye might indicate a simple treatment for an external ailment, the removal of a foreign body, or even a symbolic gesture, rather than a complex internal eye surgery. Lack of explicit surgical manuals. Unlike the Sushruta Samhita, which meticulously describes the couching procedure, Egyptian medical papyri, while comprehensive in other areas, do not contain equivalent detailed surgical instructions for cataract removal. Their focus on eye ailments is predominantly pharmaceutical and magical. Absence of direct archaeological evidence. Finding definitive osteological or mummified remains that unequivocally show signs of a successful cataract couching is incredibly challenging, as the procedure primarily involves soft tissue, and the dislocated lens itself would likely decompose. The legacy of early awareness. While the precise nature and prevalence of cataract surgery in ancient Egypt may continue to be debated, the evidence from the statue of Khepri and the New Kingdom tomb reliefs undeniably points to a profound awareness of visual impairment and a sophisticated medical system attempting to address a wide range of human afflictions. Regardless of whether they fully mastered cataract couching, the Egyptians' recognition of eye conditions and their development of specialized medical instruments and practices laid foundational groundwork. This early engagement with ophthalmology, even if rudimentary, highlights humanity's timeless quest to restore sight and alleviate suffering, a journey that would eventually lead to the precise and transformative cataract surgeries of today.